Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Ritonavir. Its brand name is Norvir. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Ritonavir. We'll then touch on an example of dosing, then finish it off with side effects with percentages. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Ritonavir is a protease inhibitor. It inhibits both human immunodeficiency virus proteases, HIV-1 and HIV-2, which prevents these enzymes from processing the GAG-POL polyprotein precursor. This leads to the production of non-infectious, immature HIV particles. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see Ritonavir used in the treatment of an HIV infection. With respect to contraindications or reasons we would not be able to prescribe Ritonavir, well, we just wouldn't give this medication to a patient who had a serious hypersensitivity to Ritonavir or to any other component of the formulation. As an example, this could present as toxic epidermal necrolysis or Stevens-Johnson syndrome. Now for an example of dosing with Ritonavir. So in the treatment of an HIV infection, if it was the sole protease inhibitor on board, we may see an initial dose of 300 milligrams orally twice daily. You would then increase the dose by 100 milligrams twice daily, orally, every 2 to 3 days, up to a maintenance dose of 600 milligrams orally twice daily. And that would be the maximum dose, 600 milligrams orally twice daily. It should be noted that Ritonavir is recommended only as a pharmacokinetic enhancer of other protease inhibitors when used in low doses. As with all medications, there are some side effects or adverse reactions that patients may experience while using Ritonavir, so we'll go over some of those here now. Edema or swelling may happen 6% of the time, while 13% of patients may experience flushing. Itchiness comes in at 12%, and rash at 27%. 26% of patients may experience abdominal pain, and 68% may experience diarrhea. Nausea comes in at a rate of 57%, and altered taste at 16%. Vomiting may occur in 32% of patients, and 18.5% of patients may experience arthralgia or joint pain. Asthenia or abnormal weakness happens 46% of the time, and dizziness 15% of the time. 22% of patients may experience a cough, and 16% may experience pain in the throat. More serious side effects may be hyperglycemia or high blood sugar, pancreatitis, or hepatitis. Alright everybody, that's all we're going to talk about today with Ritonavir or Norvir. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.